Hi, good afternoon, everybody. After a little bit of a hiatus, this is Yehudis Schamroth. Welcome back to Wellness Wednesdays, where we talk about all topics health and wellness related. Today's topic is something called PCOS, which is polycystic ovarian disease syndrome. We'll talk about what that is. I have a special guest today, Dr. Herman Weiss, who's an OB/GYN doctor who specializes in this field. He happens to be my neighbor here in Beit Shemesh, Israel. We'll bring him on in a pre-recorded interview at the end of this session. I just want to point out to you that Dr. Weiss has a wonderful website that you will have to refer to when after you hear this. I may not be able to put this on later on, so I'm doing it now. Dr. Herman Weiss is at provationlife.com. I will try to put this on later on, but you will be very interested in communicating with him and finding out his products that he sells to he's developed over many years, lots of research, lots of money, lots of time went into finding just the right supplements to take. That's the name of this title of this talk today, is how diet and good supplements can help you with PCOS. So without further ado, I'm going to get started on the webinar that I have a little introduction. You can hear this, see this on Facebook Live right now at RBS Acupuncture, or you can go to YouTube. There's a YouTube channel, and I don't have that on here, but that's fine. I do have a website though, which is rbsacupuncture.com. Okay, so let's get started talking about what is PCOS. And we always have a nice little slideshow. I'll get that started here. Okay, and I go to the corner. Very good. Here's Dr. Weiss. We're going to be bringing him on a little bit later in a pre-record. Let's see. Let's find my slides. Okay. PCOS. What is it anyway? It's a lot of misinformation about this, but it's a very popular topic now. PCOS is a problem with hormones that affects women during their childbearing years, between the ages of 15 and 44 usually. It's estimated that anywhere from 2 to 26% of women have PCOS at any time, and it is in fact the most common hormonal disorder there is. So we know it's a hormonal disorder. It affects women's menstruation, and it also affects fertility. And many people who have it don't even know they have it. And women with PCOS, there are studies that say that up to 70% of the women with PCOS have not even been diagnosed, but they've had all kinds of symptoms. It affects women's ovaries and the reproductive organs that produce estrogen and progesterone. The male and the female organs are not in that order. Estrogen is the female, progesterone is the male. These are the hormones that regulate the menstrual cycle. And I'm not going into that today, but we can one day. The ovaries produce a small amount of male hormones called androgens, and what people have in this syndrome, and I'll explain what that means, is they have an androgen excess in a lot of situations, which means a lot of male hormones, male dominant hair hormones, which give them hair growth and other things. Normally the ovaries release eggs to be fertilized by the man's sperm, and the release of each egg at every month is called ovulation. So every month a woman ovulates one egg or more if she has twins. But the problem with PCOS ladies is that they don't have any ovulation in most cases, or if they ovulate, they're not ovulating a healthy egg. And they call this PCOS, polycystic ovarian syndrome, but it's really not, as Dr. Weiss will tell us later on, it is really not, these are not really cysts. These are immature follicles that are just not developed enough to ovulate, to cause ovulation. So it's misdiagnosed many times because women, they call it a syndrome because it's usually a characteristically 3 to 4 to 5 kinds of things that go on, which I'll mention, but also so many women experience it very, very differently. So it's a syndrome, which is usually a group of symptoms, okay? And I'll go through in detail. There are sometimes follicles or cysts. There may be cysts on the ovaries. There are high levels of male hormones, and the hallmark to most all of them is irregular or skipped periods. There's something called anovulation, which means no ovulation at all. And a lot of times young ladies don't even realize they have this issue, this syndrome, until they try to go to get pregnant. And then they find the definition of infertility is usually a couple trying to have a child for up to 12 months. And if they haven't been able to conceive in up to 12 months, there is a problem with their fertility. That's called infertility. and this may be very well the cause of their infertility. But they shouldn't be worried about it, because there's lots to do. There's lots to do about it. So PCOS affects 5 to 10% of the reproductive women. We said anywhere from 2 to 27%, but it also falls into this category. So it does make it the most common hormonal disorder. And as mentioned before, this is what the picture of a polycystic ovary looks like, but it's not, again, not really cysts. Dr. Weiss explained to me in the interview that these are follicles that are immature. And so they have to be stimulated into creating ovulation every month. Okay, what is the criteria for PCOS? Now again, there's usually, this has been around for many, many years, I think even since the 1700s. But the oldest criteria, we can go back to something called the Rotterdam criteria. People who have irregular ovulation, people have no ovulation, less than 10 menstrual cycles per year. Something called hyperandrogenism, which means your androgens or your male hormones are dominant, and that can cause things like acne, hair growth, hair loss, high testosterone, and other hormones. And the polycystic ovaries, or again, polycystic is a misnomer, but there is something wrong with the shape of the ovaries, and you can have the increased ovarian size in many women. But again, they found that many women experience it differently. Some women have regular periods, but they have the other symptoms like hair growth, acne, maybe sometimes obesity. Some women have irregular periods, no ovulation, and no, but their ovaries look normal. So, I mean, everybody experiences it differently, which makes it difficult to diagnose in some cases. So we know the lack of ovulation will alter the levels of estrogen and progesterone that are already kind of out of whack. Your FSH, your follicle stimulating hormone, and your luteinizing hormone, that all these hormones that prepare for ovulation are all either under measured or over measured. They can be way lower than they're supposed to be, while the androgen and the male hormones can be way higher. And the extra male hormones, they will disrupt the menstrual cycle. So women with PCOS do most of the time get fewer periods than usual, or no periods at all. And it's not a new condition. Like I mentioned, it's been around for many, many years, but now they're trying to finally hone in on what is causing it and what we can do about it, and all the different types. There are about 4 different types of PCOS. There's not just one type anymore. So it's not one size fits all. It's all different types, and so many women fit into this category. And again, it's the most common endocrine disorder worldwide. Again, and the hallmarks for most women is I'm just repeating myself, no ovulation or very little ovulation, menstrual irregularity, and high male hormones or hyperandrogenism. And this can lead to infertility, insulin resistance, or altered blood sugar, increased abdominal fat, obesity, of course, and the ovaries will be diagnosed by examination and ultrasound. So what are the most common causes? They do know genetics plays a role. We do know that women whose mothers had PCOS usually will have PCOS too, or that's not unusual. The environment can cause, we can have all the additives in our foods and all the toxins in our environments and all the different high caloric foods, high sugar foods can cause insulin resistance, which I'm going to discuss. The liver can have difficulty in detoxing, and the ovaries themselves are affected by the androgens, by the oversupply of male hormones. So, but the root causes, they say, are 4 things: insulin resistance, genetics, increased androgens, and inflammation, which is something that I talk about almost in every single webinar I do, because widespread chronic inflammation is the cause of so many different problems in our culture, especially now. Anything from inflammation in the joints, inflammation in irritable bowel syndrome, inflammation in brains causing headaches, and ADHD. We live in a very highly inflammatory climate, meaning we're eating things that are causing chronic inflammation, which causes many, many problems and aggravates. It may not even be the cause of PCOS, but it certainly makes it worse. And in here, some people do believe it is the cause. Okay, what are the symptoms of PCOS? So again, it's multiple symptoms depending on what your cause is and what your genetics are, and everybody experiences differently. So again, I'll just repeat that you have trouble with infertility, you can have mood changes, you can have acne, you can have fatigue, you can have insulin resistance, I'm going to discuss that, High testosterone levels, more male hormones, so you have hair growth and looking more like manly than womanly. Um, again, hair growth, weight changes or trouble losing weight. Not everybody is obese, and there was a common misconception that everybody who's overweight and has a little bit of hair growth automatically has PCOS, but that's not the case. That they may be leading toward it. You might want to investigate it. There are other things that can go on too. You can have true cysts on the ovaries or tumors. You can have different difficulty with any different types of uterine issues, uterine tumors or uterine inflammation and stuff can also mimic these kinds of symptoms. But irregular or missed periods is something that we see very commonly with this. All right. Again, so here's the main checklist you want to look at. Would be irregular periods or no periods, acne, lots of acne that you can't get rid of. Now, every kid has acne, so teenagers are not even going to pay attention to this so much. But if you start having hair loss and excessive hair growth, then you're going to start to consider something's going on. I want to talk about the insulin resistance for a minute. Oh, wait a minute. Let me just say the androgen, again, the androgens, the high male hormone content will cause acne and all these things we discussed. Coarse hair and ovulation, meaning no ovulation at all. Okay, just a little bit about insulin resistance. We have it a lot in our culture, and it's very surprising to a young person, especially a young woman, but it may not be their fault. Obviously, genetics plays a role in it, but as you can see by this slide, high carbohydrates really very much aggravate insulin resistance. So it causes a high sugar content in your body will cause the pancreas to increase the insulin secretion, and the cells take it up. And the insulin's supposed to help the cells escort them into the sugar into the cells for production of energy. But if there's too much sugar, the insulin keeps pumping more and more to take care of that excess sugar, to kind of mop it up and do something with it. And in fat, instead, the sugar gets stored as fat, and you get too much fat, and too much sugar will cause inflammation and aggravate whatever existing inflammation there is. And they do say now with recent studies that up to 70% of women with PCOS do have insulin resistance. So it means their cells can't use the insulin properly. And we know the insulin is also a hormone. That I mentioned that the pancreas uses us to help bring sugar into the cells for energy. But if you've got too much sugar, you've got too much insulin, and the body gets used to it and it can't use it effectively anymore. It's like when you take too much of an antibiotic, the body can't process it anymore, and you need more and more of it. So when the cells can't use the insulin properly, it makes more and more, and extra insulin triggers ovaries to produce more male hormones. So that's where the PCOS comes into this. So you have to be very careful if you are overweight and you think you might have PCOS, and I'll talk to you about when you should go see a doctor in a few minutes. But insulin resistance is a very big problem. So you will have as part of your workup probably glucose tolerance tests and things like that. So because we do know that too much insulin will cause the body to make that male hormone. And one sign of insulin resistance, of course, is dark patches on the skin, bigger appetite, you grow bigger, and you have hair growth too, and all that. So you want to keep that under control, because the more you have sugar in your system floating around, because the insulin can't take care of it, it's using you for energy. So that causes. I learned way back in nursing school, like 40 years ago, that sugar kind of pokes holes in, so you know that your blood vessels are going to be damaged, and everything else too, including your ovaries. So not only do you have an excess sugar causing damage, it increases inflammation. And inflammation is that redness and that inflamed tissue that can't absorb things properly. It causes leaky gut. There's lots of different problems. So we want to prevent that as much as possible. So one of the treatments we'll say down the line will be if you think you have insulin resistance, you can be tested for it, and you'll have to definitely go on a low carbohydrate diet of some sort. Now, inflammation is another problem with another thing they find is a core of a PCOS. So what does that mean? What is inflammation? Again, I can beat this as a dead horse, as they say, over and over. Inflammation is the biggest chronic problem we have in our world today for almost the underlying cause for just about every problem we have, from diabetes to heart disease to PCOS to irritable bowel to chronic migraines. It's usually the cause of everything is going to be chronic inflammation. Okay, we call it low grade inflammation also. So the white horse, They make these substances to respond to injury, right? And so the white blood cells get sent out to take care of it, and it sets up an inflammatory response. Okay, so it's called low grade. So that's normal because we want to be able to fight off infection. But when it goes on and it builds higher and higher, it causes lots of damage to the cells. And again, the permeability of cells becomes weakened, and things go in and out that shouldn't go in and out, and things that you want to take. Let's say you're taking supplements. You have a whole table full of supplements. They're just going right through you because your body isn't able to absorb them because the digestive system is all inflamed. You might not even feel it. I see this on a lot of people. They have a terrible digestion and they say, oh, I have a great digestion, but they don't, but they're telling me that they have bloating, that they have gas, they have chronic fatigue, they have depression and anxiety, they have acne and other issues, food allergies, weight changes, insomnia, seasonal allergies, candida overgrowth, things like this. We know that there's got to be some kind of root cause causing low-grade inflammation, chronic inflammation, and we know that it goes overflow into infertility, gestational diabetes, can cause miscarriages. Something called metabolic syndrome is something that even a young person can have. We always tend to think that metabolic syndrome is something just for adults who have high blood pressure. There's criteria that you have to meet: high blood pressure, obesity, diabetes, things like that. But metabolic syndrome is a cluster of conditions that unhealthy cholesterol that even a young person can have. Type 2 diabetes develops earlier. Sleep apnea, of course, is a secondary cause, or secondary issue from obesity. So, and worst case scenario, obviously cancer of the uterus can happen. So we know that inflammation, insulin resistance, and obesity are big problems in PCOS, not for everybody, but you're going to have to be fully worked up to see what your root causes are and then treat them accordingly. So if you are struggling with what you think is PCOS, if you're having irregular periods, if you're having infertility, if you're having excess hair growth, weight gain, acne, or thinning hair, your body is trying to tell you that something isn't right, and you should check it out. So when do you go to the doctor? Okay? You want to keep in mind, too, that the symptoms and history are very important parts. So keep track of everything so you can give a good report to your doctor when you do go. So, and if you might wonder if you're suffering from PCOS, those are the things you wanted to report to your doctor. You start out with your gynecologist, who will be the first person that I would go to. How do you get a diagnosis now? When you go to a doctor, do you go to a regular doctor or do you go to an endocrinologist knowing that it's a hormonal problem? So first, probably start off with your general practitioner or your gynecologist. I would start with the gynecologist. He's a medical doctor. She's a medical doctor who specializes in female reproductive stuff and health, and they know all the preventative strategies, and they're up to date on everything you need to do on the testing. Generally speaking, you have some blood tests to test for inflammatory markers. You can have an ultrasound to see what shape the ovaries are in, what condition they're in. There's usually no any biopsies or anything like that. But Dr. Weiss told us in the interview, you'll see that there are surgical treatments that they might do to help with this. So the diagnosis is ultrasound, history mostly, and some blood tests. So the ultrasound will detect enlarged or normal ovary function and presence of those follicles we mentioned. You also want to take blood tests. Will tell us if you have high androgen levels, and then of course they all go by your irregular cycles. Try to keep track of that, and but your doctor will send you to an endocrinologist if need be, because there are other diagnostic conditions too that can mimic these problems with the obesity and with the weight gain and with the irregular periods and so on. There's things, the hormonal problems called things like Cushing syndrome, or things that we really don't have to worry about unless the doctor sends you. Hypothyroidism, congenital hyperplasia of the adrenals, ovarian tumors. There are things that you don't want to scare you on here, but there are other things that can cause these symptoms. But you start off by going to your gynecologist or a general practitioner that sees gynecological things. And then you'll go to the endocrinologist if there's something more to do. Okay, what are the medical treatments for this? Medical treatments, of course, will surround medications. So that's something we do try to avoid, and I'm happy to report that most doctors now do not just jump to medications. They try to do natural and alternative stuff first. But just to mention, they might put you on birth control pill. It regulates your periods, and it can stimulate the ovulation. It can regulate your ovulation, and it can also relieve symptoms of excess hair growth and protect against endometrial cancer as well. There's a medication. It's an anti-diabetes medication called metformin or glucophage. It's a drug they use to treat type 2 diabetes and helps keep insulin under control. But this is going to be probably unnecessary if you can really get on board with some more alternative treatments and supplements, which I'll mention soon. There's the medication called Clomid, which is a very typical medication given by infertility specialists, fertility drug. It helps a lot of people with PCOS get pregnant. So if you want to skip over the natural stuff, you can go right to the infertility doctors, and they'll put you on all kinds of medications. I'm trying to encourage you not to do that this first step, but if you need to, that's your choice. There are surgeries out there too to help it's a procedure that helps make tiny holes in the ovary actually. It's like a laser procedure, and it helps stimulate ovulation. Okay, so just as a bottom line, if you missed your periods and you're not pregnant after a year, and you have any of these symptoms of PCOS, hair growth on your face and body, and you've been trying to get pregnant, and you have any kind of symptoms of diabetes at all, like thirst or hunger or blurred vision, which I didn't discuss, but those are symptoms of diabetes, you must go to the doctor right away, be evaluated. Okay, so once you get your diagnosis, let's talk about how we can give you some treatment. First of all, we want to focus on dietary and lifestyle tips, and also supplements. So let's look at this slide here where you want to go to healthy eating no matter what you have wrong. So let's heal your PCOS before we go to medications if possible. You want to control the sugar. You want to regulate the blood sugar control. We want to reduce stress. We want to go on anti-inflammatory eating, which also doubles up as anti-sugar too. It lowers because you eat very few carbs on anti-inflammatory diets. You want to eliminate toxins in your body, and you want to take a lot of good vitamins. So how do we do that? First of all, just want to mention that there are a couple of nice herbs out there. I'm an herbalist as well. Licorice, white peony, reishi mushrooms, and spearmint all help contribute to keeping the ovarian health in your body. And you can see that licorice will decrease the testosterone. White peony will inhibit testosterone synthesis. Reishi mushrooms will inhibit the DHT, which is another hormone. It causes male androgens to go up. And spearmint reduces the testosterone. So for the androgens alone, there are a lot of things you can just take naturally. You can add to your foods. You can get from an herbalist like me. Here's the anti-inflammatory nutrition chart. And of course, we want to start off with a lot of water as the bottom that you want to stick to good hydration, non-starchy vegetables, fruits that are low in glycemic index, balanced protein, healthy fats. I do this over and over in all my webinars. I'm not going to go through which is which. You can watch my previous ones because I go through in detail what are the healthy fats, what are the balanced proteins, which are the best vegetables and herbs and spices. And dark chocolate you can have every day, but you want to stay away from carbohydrates really in a big way for this, even if you're not obese, because you want to you want to do some kind of blood sugar control, and the only way to do that is to stay away from carbohydrates if you're not taking medications and supplements. This is a product that that I mentioned before that Dr. Weiss has created over many years of research. When I have women come to me, I say you have to go on the following protocol for taking supplements, because you want to control your blood sugar and you want to keep the blood the cell's integrity, so that there's not a lot of passing forth of bad things going in and good things leaking out of your system. You want to regulate the blood sugar. With decreased inflammation, all the different things that I would tell people to take are in this one product. There's something called inositol, which was known to, like the B vitamin in the B vitamin family, I believe, and it is excellent at controlling blood sugar. And that's what we want to do in this situation. Controlling the blood sugar will decrease the inflammation and make the whole body healthier, including the reproductive system. Vitamin D is crucial for our blood cells and all the cellular level for the integrity of the cell. B complex vitamins are crucial for controlling blood sugar and decreasing inflammation. Fish oil and omega-3s, we know. Something called berberine, very crucial for helping control blood sugar and inflammation. Magnesium and zinc. So, and also we know turmeric is also, people are really into turmeric to help increase the blood circulation, and that also decreases inflammation in the body. So as you can look at this chart here on the back of this product, it's got magnesium, zinc, potassium, folate, which is what women want to take when they're trying to get pregnant, obviously the folate. Chromium is in here, inositol is in there. Red yeast is something that we know decreases cholesterol. Organic cinnamon powder, cinnamon and turmeric are two different herbs that are considered warming and moving herbs, and they decrease inflammation in the body. And coenzyme Q10, which people take for inflammation. So you want to take this product, and Dr. Weiss will mention it too. I want to just put his website up there one more time before we bring him on as a pre-recorded. Okay, those are the supplements. Let's go back to my, I can't get this over here. There we go. Let's find Dr. Weiss here. Okay, it's on the bottom here. Dr. Weiss, trained American OBGYN, now lives in Israel, specializes in women's issues, especially PCOS. So you can contact him at provationlife.com. And without further ado, we're going to bring in Dr. Weiss's pre-recorded interview.
We good?
Okay, I'm recording now. Hi, this is a pre-recorded interview with my very illustrious guest, Dr. Herman Weiss. Hi, Herman. Thank you for joining us, Dr. Weiss.
Thank you for having me. Wonderful to be
He's
here.
right down the road in Israel with me. He'll talk about that maybe. I found Dr. Weiss to interview because I decided to interview him because I was seeing quite a few patients with PCOS, and I'm a nurse that does acupuncture, and I was looking for both medical perspectives. My husband's also an OBGYN, so I consult with him about things, and I found that there were many, many supplements and dietary changes that these women could go on to help, enable them to treat the PCOS and even get pregnant in most cases. And then I discovered that Dr. Weiss was doing the very same thing down the street, but he's got something even better going because he started a whole supplement company, and he's, of course, a medical physician. And so I want to hear his perspective on things, and just want to say that Dr. Weiss, after receiving his MD from Ohio State University, he earned his MBA, which is very impressive, from George Washington University, and was specially trained in women's health at Einstein Montefiore Bronx. He's a co-founder and medical officer of Fibro Control, company involved in minimally invasive techniques to treat women with fibroids. Throughout his career, he's always sought a holistic approach to curing and preventing disease, which of course I do the same. And I didn't discover it until well into my medical career. I was a nurse anesthetist for probably 15 years before I even considered anything alternative, and boy did I feel like I had a lot of catching up to do. There's so much treatment to offer patients that's not just medicine and surgery medicine. So Dr. Weiss is an OBGYN physician. That means he does obstetrics and gynecology. He's an expert in hormonal irregulars and health, reproductive health, and he's been helping women with PCOS to regain control of their ovarian health for over 2 decades. So thank you again for joining us, Dr. Weiss.
Oh, thank you so much for having me. I appreciate it. Yeah, it's so funny that we're neighbors almost, and we, over your course of your career and over the course of my career, we gain all this knowledge and experience, because it's not just the book knowledge, but it's also how you apply the knowledge, and these techniques evolve, and why they evolve is because it works, okay, and it works because people like yourself and myself and other practitioners who continually, emphasize not only the right medications when necessary, but the right, lifestyle modifications. So yeah, it's very exciting, and I'm happy to be here.
Good. Well, I've already reviewed in the previous segment the different types of PCOS and what women might be diagnosed with it. Some women do know they have it, some people don't know. And they meet way different criteria and profiles, which was a surprise to me in the beginning. I didn't even realize, I always thought there was one type of PCOS, and I was stunned to find out, I'm talking about not yesterday, but I mean in a few years
Right.
back, that there were many different profiles. You want to discuss that a little bit?
Yeah, so it's interesting. You touch on a lot of really important points, and I'm sure you've talked about this in terms of the intro. But PCOS is the number one endocrine disorder of women. Okay, it's far outshines thyroid disorder, which is also up there, diabetes, which is also very very high in women. But it's 10 to 15% of women. In some populations, it's even higher. In India, it's much higher. I see it a lot in Ashkenazic women. I feel like it's rampant here. And so upwards of 20%. So that means that of every 10 women I see, 2 or 3 of them have it, and sometimes I get 5 in a row and some craziness. And so the challenge is that life is a pendulum. You're right. You live and you exercise one week, you eat right one week, and you kind of like we kind of wax and we wane and we kind of go through the with the motions and the motions in the ocean, so to speak, and we kind of are good one week and bad one week, and so it's very challenging to make the diagnosis. And your specific question was how many different types of PCOS are there, and what would make me think of one. I think that unfortunately the studies have shown that women can go upwards of 2 years before they get a diagnosis of PCOS, and before they sometimes they go to 2 or 3 doctors who fumble the diagnosis or suggest the diagnosis, or worse, this is what happens, and I see this all the time. They say, well, I checked your bloods and you don't have PCOS, you have some other thing going on and I don't know what it is. Go to an expert and whatnot. And to be honest with you, that's like the worst thing they can do, because when I always check patients' labs, I tell them, I say, the labs are helpful to a degree. They will tell me what your blood shows at the moment I did the lab, not 5 minutes before, not 5 minutes after. And as we know, there's so much. Are we good?
Okay. Well, I've already reviewed in the previous segment the different types of PCOS and what women might be diagnosed with it. Some women do know they have it, some people don't know. And they meet way different criteria and profiles, which was a surprise to me in the beginning. I didn't even realize, I always thought there was one type of PCOS, and I was stunned to find out, not yesterday, but I mean in a few years
Right.
back, that there were many different profiles. You want to discuss that a little bit?
Yeah, so it's interesting. You touch on a lot of really important points, and I'm sure you've talked about this in terms of the intro. But PCOS is the number one endocrine disorder of women. Okay, it's far outshines thyroid disorder, which is also up there, diabetes, which is also very very high in women. But it's 10 to 15% of women. In some populations, it's even higher. In India, it's much higher. I see it a lot in Ashkenazic women. I feel like it's rampant here. And so upwards of 20%. So that means that of every 10 women I see, 2 or 3 of them have it, and sometimes I get 5 in a row and some craziness. And so the challenge is that life is a pendulum. You're right. We live and you exercise one week, you eat right one week, and you kind of like we kind of wax and we wane and we kind of go through the with the motions and the motions in the ocean, so to speak, and we kind of are good one week and bad one week, and so it's very challenging to make the diagnosis. And your specific question was how many different types of PCOS are there, and what would make me think of one. I think that unfortunately the studies have shown that women can go upwards of 2 years before they get a diagnosis of PCOS, and before they sometimes they go to 2 or 3 doctors who fumble the diagnosis or suggest the diagnosis, or worse, this is what happens, and I see this all the time. They say, well, I checked your bloods and you don't have PCOS, you have some other thing going on and I don't know what it is. Go to an expert or whatnot. And to be honest with you, that's like the worst thing they can do, because when I always check patients' labs, I tell them, I say, The labs are helpful to a degree. They will tell me what your blood shows at the moment I did the lab, not 5 minutes before, not 5 minutes after. And as we know, there's so much interday, interminute, inter-hour fluctuation that it doesn't really help me to paint someone in a picture based on labs. I don't treat lab tests, okay? I treat patients. And if a patient, looks like a duck, sounds like a duck, it's a duck, so I find that we are in medicine. We're very, we have the blinders on. We don't take other cues, and sometimes, and this is where I found myself not straying to, but seeing when a patient walks through my door, I knew exactly what she had before she sat down. I knew what I was going to give her. I knew I was going to get her out of my office, and it's a tremendous disservice because right now, when a patient walks in with PCOS, and again, I know there's a long-winded answer, but I have a lot to say on the topic because this really didn't answer your question, but when a patient walks in with PCOS, the doctor has oral contraceptives or other type of contraceptives they don't want to conceive, and then infertility medications that they want to conceive. And that's it. And there's so much more. In fact, that's only it could be that they do need oral contraceptives, and it could be that they're going to need the infertility medications. But our job is to identify that and walk them through the actual pathophysiology. What is underlying? What's going on that's causing this? And then some lifestyle modifications, alterations can actually make such a huge difference, and it's been proven to make differences. Now, what I've done in my company is put them all together and kind of identified it, educate patients, and enthusiastically support that. So to answer your question about what different types of PCOS there are, there's four described. There's insulin resistance, there's adrenal, there's post pill, and inflammatory. Okay, those are the four different types of PCOS. By and large, the insulin resistance is 70+% of all PCOS is insulin resistance, followed by the others in a smaller percentages. But my point is that I don't care what type gets them to PCOS. They have PCOS, and they may go in between one or two or three or all of them or none of on any given day. So if we are able to get them anti-inflammatory supplement, anti-inflammatory diet, improve their microbiome, improve all these different aspects of life before we get to the birth control pill or get to the infertility treatments, I think we could do them a tremendous amount of good. So I don't like quantifying. Oh, you have inflammatory PCOS. Oh, you have adrenal PCOS. Oh, you have insulin resistance PCOS. I think it's all of the above, and they're all shades of the same the same flavor, so to speak. And you just need to get them to understand the process, what's happening.
Okay, that's interesting because I was wondering what I was thinking. What you were talking is that the ladies that come to me, and are usually young ladies, obviously, and they're wanting to conceive children. And we, of course, live in a religious community where it's very important that they can have children, as soon as possible. A lot of cases.
That's why I'm seeing so many of them in this community because of their not their needs, because their desire, but it's any community. So I don't want to say religious, non-religious. It's anyone that's interested in conceiving or even interested in not conceiving. Also,
I'm just saying that's why I see them, I suppose. But but also I've had a few, and not too many, that were very young women, like 15, 16 years old, and their mothers would bring them to me and say, "My daughter's really overweight. My daughter has a lot of hair growth, and she's very irregular periods, and I don't know what this is." And between me and my husband and the blood test, like you don't like to treat blood tests, but we would, or maybe their own gynecologist, or the kids were kind of too young to go to a gynecologist. So this is how often do you see very young girls with this?
So what here fortunately, as you're well aware, I'm very active in the community in terms of seeing patients, and when I do my regular history of the patient, I talk to them. Oh, do you have any other sisters, or do you have any was your mother? And then if I talk to the mothers, because I also been treating women in different age categories, they tell me about their daughters, and I'm emphatic about getting them in, not to be an exam, just to talk to them, to explain that you're being heard, that you're either it's the weight issues or your menstrual irregularities. The sooner you get them to understand the pathophysiology of the disease, and I hate calling it disease, of the syndrome, of the findings, the faster you get them in, the better, the easier it is downstream.
Get her down the road. So
the
you're saying that if
infertility
they get their
picture.
blood sugar under control, let's say, or their weight under control, or the inflammation under control,
Well,
that's true for everybody if you think about it, but especially with people, now when you say
right.
PCOS too, it's not always cystic, polycystic, is it? Is that
No,
always
no,
a
no.
hallmark? Can you explain why it was named like that then? Why it was named that
Yeah,
way?
so historically, Stein Leventhal did this. They were gynecologists back in the 50s or 60s, maybe. I'd have to double check when they did this, but they saw ultrasound findings on ovaries that were consistent of having multiple small follicles. And they're not cysts. Cysts are above 2 centimeters. Anything under 2 centimeters is called follicles, and they would show up around the periphery of the ovary, and they almost it's called a pearl necklace sign. And so for lack of better, they didn't have much to do, hormonally at that time. So a lot of these patients did surgery, and the problem is that basically because their hormones were out of whack, and I'll reggle off on one foot to explain to you what the process is, and you know this, but maybe for some of our listeners,
For the
the
listeners.
brain tells the ovaries to ovulate. The after ovulation, the estrogen triggers the ovulation, and then after ovulation, the progesterone is there to support either a pregnancy or when the progesterone falls to cause a menstrual cycle. But the brain messages are not aligned, and the estrogen never hits a crescendo, which causes it doesn't cause the ovulation, so you never get that good progesterone. What the ovary hears though is these static messages, and not a nice wave type messages, and so it's these messages that kind of bursty stimulate the eggs, many eggs, not one, which usually happens. The dominant follicle comes out, but many of them do, and then you get this what we call the pearl necklace view of where you actually see an ovary which looks dark, and then around the outside you see like these follicles. Now that's important because to make the diagnosis of PCOS, other than my gut saying, hey, I think you have it, and we're just going to do these confirmatory tests, you need to have elevated androgen levels, which is male hormones, or your hormones need to be a little bit off in the blood work. You need to have changes in your menstrual cycle, either too much, too little, or none, and that alters your ovulation as a result of your altered ovulation. And then the third thing is sonographic evidence of multiple follicles. And so when they did these surgeries to evaluate and identify these patients, Stein and Leventhal, they used to do something called ovarian drilling. Basically, what happens is that as these patients were not ovulating, I'm sorry if I'm getting too medical here, but
No,
as
it
they were
sounds
not
awful. It sounds
ovulating,
like ovarian drilling. It doesn't sound like it's going to help anybody with anything.
well, I'll explain to you the purpose of it. Basically, if these patients don't ovulate, the lining of the ovary gets thicker and thicker, and it makes all the subsequent ovarian ovulations much more difficult. And because it's much more difficult, you want to, that's what was, to answer your question about getting involved at age 15 to 18, is that if you don't start down this path and make the lining of the ovary, the surface of the ovary thick, okay, you're able to prevent downstream effects. That's why the earlier you identify it, the better. Now, just the ovarian drilling is very simple, and it actually works very well. You basically go in and kind of like just cauterize and allow some of the stress of the ovary to be released, so that when they come to ovulate the next month, it's much easier for an egg to be released. So it actually worked very, very, very elegantly. Even though it's maybe not such a nice term, it worked very well. And these patients had like a relief of their symptoms. Yeah. So I think hopefully I answered your question. I didn't go too much off on a tangent, but
Well, we were talking earlier about, yeah.
yeah, so just to answer your question, sorry, so yeah, I remember your question. So it's a little bit of a misnomer to call it polycystic. It's not really cysts, it's multiple follicles. Unfortunately, that's where we're at, right?
The follicles toughen up and thicken up the ovary, so it makes it difficult for ovulation.
Ovulation, exactly.
Let's talk about your products a little bit. What do they do to help the body ovulate more efficiently or better?
Thank you for that opening. So what we've seen is that PCOS is it's complex, it's multi-system, it's endocrine, it's psychological, it's dealing with fertility, dealing with pregnancy related, and so what we've seen is that a high preponderance of these patients have elevated inflammatory markers, like we talked about the pro-inflammation, and and they have elevated insulin resistance. Now, they're not diabetics, but a high proportion of them, if left untreated and ignored, will develop type 2 diabetes later on in life. We know that to be a fact. That's
Do they have high blood glucose, by the way?
Some of them do, but it's more of a fasting. They have a fasting, elevated fasting glucose and elevated fasting insulin. They don't. Okay, I want to make it very clear. They don't necessarily have diabetes, but they have a high preponderance of developing diabetes later on in life, and so what we've seen, and this is what I started doing in my practice over 20 years. I started saying, why don't you take these supplements, and I had a whole list of literally 8, 9, 10 supplements, including magnesium and zinc and chromium and inositol and cinnamon, coenzyme Q, berberine, turmeric, and I said these are anti-inflammatory. They are anti-insulin resistance, and where did I get them from? Is I looked at all the supplements that type 2 diabetics were using, and there's great data on it.
Well, I did too.
And I scratched my head and I said, why? And then so this is exactly what happened. I was telling my patients, these young girls were coming to me, newly married, couldn't conceive for 6, 7 months. I actually knew their parents, and they were coming to me and asking for, and they're all going to IVF, and IVF is great, and we have a wonderful country here that promotes it. But I always tell patients, if all you have is a hammer, everything you see is a nail. Sorry.
All right.
Yeah. If all you have is a hammer, and then everything you see is a nail. So if I'm an infertility specialist, everything that I do is just going to be a infertility, and they're going to go down that path. And there are so many steps beforehand that are better for your metabolic and your entire complex multi-systems, as opposed to just going and getting infertility. So this patient came to me, and I said, why don't you try this for 6 months? And as I sit here, she conceived within 2 months on my supplements, and she had she's out to her next pregnancy as well. And so her father is a doctor, was in the States. He sent me a picture on my WhatsApp, and he said, Herm, is this what you want her to take? And sent me a picture of 5 different supplements. And I said, yeah, that's perfect. And then I scratched my head and I said, this is crazy. I said, why don't I put that all together in one, and then the patients don't have to search for it. It's going to be cheaper. It's going to be more effective, and the compliance is going to go up. And it's all in one supplement. And sure enough, I put it all together. I actually patented it because I'm taking not only the PCOS perspective, but it's also the type 2 diabetes perspective, and putting it together and having synergistic effects. And patients are doing really wonderful on it. And
can you list again what supplements? First of all, your website is called wait, I have it here. Provation Life.
Yeah.
ProvationLife.com, which I will put in the sidebar when I do the when I air the interview. So Provation Life is your website, and
so there's also another website, education.provationlife.com. That is basically goes through a lot of the same things that we just went over. And it is and I'm starting to do webinars and trying to get more of the word out there, because just before I go through the specifics of and why I chose those specific ones, and I list all of them in the website, and you can really see the data, and the bibliography is there. But one of the things that I do with my patients, and I draw out a picture, is I say PCOS is the center of the Venn diagram, and you have diet and nutrition, and they ask me, well, what's the difference between diet and nutrition? I said, diet is what you eat, nutrition is how you eat, when to eat, where to eat, with who to eat, and whatnot, and it's a very big difference, and how you support everything. And diet is huge, and one of my partners is a nutritionist. Her name is Lauren Allen. She's phenomenal. She tells her story in one of our snippets, and she talks about her diagnosis of PCOS, and she actually got out of it via, and the doctors, unfortunately, not that we're horrible, but they say, oh, you're infertile, you're not going to have babies, you need infertility, and that's not helpful at all. And she got out of her PCOS with diet alone, and then the next circle is diet. I'm sorry, and supplements, I should say, because she does. When I first initially approached her, she wanted to know my list of supplements, and I told her my list of supplements, and she was like, great, this is perfect, this is exactly what I'm taking already, plus more. So diet, nutrition. My next box, or circle, I should say, is exercise. Now, there's good exercise and there's bad exercise, because if you remember, there's adrenal PCOS, and adrenal is cortisol and stress hormones, and if you're putting yourself under a huge amount of stress, you're going to be triggering the cortisol, and you're going to be like, even though you're not a pure adrenal PCOS patient, you could be worsening your other PCOS. So the right exercise. So one of Lauren's friends is her name is Esther Taub Schlesinger, and she actually has a big following on Instagram, and she also had PCOS, just had her second or third baby, also via exercise, nutrition, and getting herself, righting the ship. So diet, nutrition, exercise, mental health, okay? Because the mental health happens to be a huge portion of it. And when I say mental health, I'm talking about, and this aligns with with where you're coming from, acupuncture, making sure that your inflammation in your entire body is under control, getting outside, not only to exercise, but getting the sun on your skin. And we're in with our patients with wearing their clothing up to here, I say, listen, just try to get out there as much as you can, because it's you need to get out there, and it's a positive. The exercise releases endorphins, the melatonin, everything that triggers that positive. It decreases your anxiety level, which actually improves your hormonal cycles. So mental health, microbiome. You know that there's so many different microbes and bacteria that live in our bodies.
Like the many webinars on that one, yeah.
Yeah, and improving that, and doesn't, again, none of this happens overnight. It's a process that you have to be really engulfed with and really embrace. So the microbiome is another portion of it, and then supplements, and we'll talk about my supplements in 1 second. And lastly, if need be, medications and pharmaceuticals. Unfortunately, a lot of my colleagues are just pushing towards pharmaceuticals when you're ignoring the rest of the patient. So I chose a specific myo-inositol that has been shown to improve ovarian function time and time again. It actually improves type 2 diabetes and actually ovulation and success of infertility treatments. Chromium is been used also for insulin resistance. Cinnamon, Ceylon cinnamon, turmeric, berberine, coenzyme Q, and magnesium and zinc are also critical in the anti-inflammatory and in the ovulation pathway as well. So it's loaded. Why am I thinking I'm missing one? Oh, red yeast. Also, it's
Lower blood sugar.
yeah. Also targeted on the type 2 diabetes, insulin resistance front. Insulin resistance, you need insulin in your body, but if you're eating the wrong things and doing the wrong exercise or lack thereof, your body, your insulin, which is healthy, is going to be taking your glucose, which everything gets converted to, and just pushing it into your liver as opposed to pushing it into your skeletal muscle. So one of the first things I tell patients to do is exercise immediately after you eat, like the 20 minutes after you eat. Go out and not even a lot, just do 20 minutes.
Let's do something.
20 minutes of getting your body moving. Because if you just sit on the couch and kind of just vegetate, you're doing the worst you can, because basically the body is sending out its insulin, which is necessary, and it's just shifting all of the glucose intracellular into the liver and whatnot, and glycogen, and it's just it's causing more long-term harm. So exercise, get out there and use your glucose for your energy.
Wonderful advice. Okay, we are down to the last 5 minutes of our 30-minute program. Maybe you're going to drop over, I don't know. But is there anything that you should advise these people to do, these women? Should they go, like you said, they should go in earlier if they have the symptoms, but are they having symptoms anyway? I mean, besides infertility, are they going to be having symptoms?
So you touched on these young patients who may have difficulty losing weight, but weight loss isn't our goal. It's a nice thing to have secondary
Side
effect.
effect, yeah.
It's a side effect of a good diet and good exercise and good nutrition. They get very frustrated because they're like, oh, I am eating right and I'm exercising and I just can't lose the weight. Don't focus on the weight. Focus on the eating well. Focus on the menstrual cycles. Focus on the regularity. And so, and again, the mental health aspect of it is huge. Because if you focus on it and you're not losing weight right away, it's going to be a turn off, and you're going to binge, your ice cream, Ben and Jerry's, and so don't focus on that. So start something that you simply can manage, and that's as simple as 20 minutes after you eat, getting out and moving your limbs, even getting one of those bands and doing you can do a whole body workout in 20 minutes. And I'm telling you, because I do it when I have patient cancels. I go, I got 15 minutes. I grab a band from my bag and I put on a YouTube video of resistance band workouts, and boom, I have this 20 minutes and I feel great. So after you a full meal, also learn what you're eating. Quick lesson. One of my patients who had gestational diabetes, and she was doing great, and she was showing me her finger sticks, and she thought she was doing great. Turns out one of the worst foods that she ate was rice. Okay, she would eat rice and her blood sugar spiked up, and so it's not that you don't eat rice, but you gotta eat your proteins first, get your body working on the proteins, and then you put in your other healthy carbohydrates.
Right,
So
that's something your nutritionist can talk to you. If they want to talk to Dr. Weiss, I'm going to put his website here. I don't know if he has his personal number on there, but he'll certainly get back to you if you write a message to him on the website, as he did for me. And I just want you to know too, there is a place for acupuncture and regulating hormones and weight control and things too. Like you said, weight control should not be the primary thing for this. But listen, I'm running out of time. I just got a warning message. I want to thank you for joining us, and I want to do on again if I can. And I want to tell people about your webinars and your what you offer in your practice. And you probably do international webinars and things too. You don't have to live here to.
Yeah, absolutely. I'm happy to see anybody in my office or can contact me through the website.
Okay.
We'll be publishing our webinars from time to time. But it was wonderful. Well, maybe I'll get you on one of my webinars. Just continue.
But I'll give you the benefits of acupuncture for PCOS, and also really there's a lot we could mesh together with this. I really feel like this is evolving medical care, which is I think what we should be been doing for many years, but now finally at least we're all paying attention to the fact that alternative people have to turn to medicine and medical people have to turn to alternative things, and we have to put it together in an integrative kind of way, which is what
it should be like this.
Beautiful.
It shouldn't be separate.
You're right. I'm gonna go. Thank you so much, and it's
Thank you very much for having me. Just very good. Okay,
we'll talk soon again.
Thank you.
Okay, everybody, thanks for joining us, and don't forget to contact Dr. Weiss if you have any questions at provationlife.com. See you next time.